Hey guys, welcome back to another video. If you're new here, hi, my name is Siobhan and I make videos about medical school and university. So today's video is another one in our series of videos about medical school interviews and things that might be important for them. So today, as you can see from the title, I'll be discussing a little about medical ethics, which is a very central topic for these interviews because you need to know a lot about ethics and how to deal with certain ethically challenging situations and basically how to approach these situations, what sort of mindset you need to have, what things you need to know. So yeah, let's get right into it. So basically, medical ethics is built upon four very central pillars, and these pillars are beneficence, which is acting in the best interest of a patient, non-maleficence, which is not doing no harm to the patient. Then you have patient autonomy, which is giving the patient the right to make an informed decision. And finally, justice, which is a fourth one, which is providing equal care to all your patients and without any bias or without any external influences, treating everyone the same in that sense. So keep these four pillars in mind while I move to talking about what you need to consider with ethics. So as a doctor, you're going to be facing many ethically challenging situations, and there are a number of hot topics relating to ethics, for the lack of another way to put it. And such situations can be providing contraceptives to an underage child, dealing with issues surrounding abortion. Then a very common topic is euthanasia and assisted suicide and scenarios relating to this. So basically, medical ethics encompasses a lot. So like I initially mentioned, you can have situational issues with medical ethics, or you can have basically just topics to discuss. So you definitely initially want to familiarize yourself with certain important topics such as, let's say, euthanasia, assisted suicide, abortion, organ donation, things like this. If you check out the Medic portal and the ISC medical interview book, you will definitely find a list of these important topics relating to ethics. And then you also want to be able to approach ethically challenging scenarios where you have to make decisions based on your ethical knowledge. But both of these are tackled in a similar way. So obviously, as I said, for the important topics that I mentioned earlier, you need to have pre-existing knowledge on these, because that's something that you can't really make up on the spot, because you need to know something about them already, and for that you'll have to read about them. You'll have to read about the arguments for doing a specific thing and arguments against doing a specific thing. So, and you want to incorporate the four pillars of medical ethics into those points and why each of those points matters. But then when you're dealing with ethical scenarios where someone throws a scenario at you and you're like, what would you do here and why would you do it? You want to have to put it in the best way possible. You want to have a fluid yet structured approach. So it shouldn't be like, oh, first pillar of medical ethics, this will happen. Second pillar, that will happen. Fourth pillar, not like that. It should be more like, I would take this step. This is the first step that I should take, because that's what requires immediate attention in the situation. And this is because it relates to this pillar, for example, whether it's preventing the patient from being harmed or doing something that's in the best interest of the patient, or this is what I would do first so that patient confidentiality is maintained, or so that the patient has all the information needed to make a particular decision, or I won't infringe upon the patient's right to take this particular action because the patient has autonomy. Like that, you want to approach it in a fluid way, but there should be some degree of structure into it, which is brought in through your pillars of medical ethics. And basically, the situation with ethics is, especially when you're talking about the set topics around ethics, you don't want to have a conclusive argument, because there's never a conclusive answer with ethics. It's always moldable, and it's very often situational, where it's very dependent upon the factors in that particular situation. So it's hard to come up with a generalized answer for these ethically challenging scenarios. So you want to deal with it on a very individual basis, and therefore you want to prepare yourself with the tools to approach a certain situation and to come to a conclusion in an individual scenario, rather than to have a pre-prepared answer or a pre-prepared conclusion that you get to. Yeah, basically that should cover everything regarding your approach to medical ethics, and hopefully that gives you some insight into handle questions that may come up relating to medical ethics. And yeah, I hope it was useful, I hope it was helpful, and if it was, be sure to hit the like button down below and to subscribe to my channel for more videos on interviews and more videos on other things relating to medical school. So yeah, that's the video.